we had kinetic chains, we had a look at fascial lines, we considered back and neck injuries, we touched on taping and pregnancy, and taping with lymph drainage. Today we're going to take a look at shoulders, we're going to have a look at elbows, hands, and then just a little bit of a summary on what we've done. Okay. Now, shoulder injuries are very nice for taping, especially with your dynamic and your kinesio taping, because it allows for a lot of movement, yet you are able to release the muscles and protect the joint. Supraspinatus and infraspinatus. The injury process is usually tendinitis, fraying, muscle tear. There may be accompanying bursitis, but pain is usually from muscle damage. Tears in the muscle increase the muscle tension, which leads to stiffness. The bigger the tear, obviously, the greater the tension. But we also have the myofascial pain syndrome with trigger points that contribute to our shoulder pain. KT for pain and triggers, and dynamic tape to assist within the movement when a muscle is torn. So whenever we look at shoulder injuries, we've got to go and see, is this an actual muscle that I've got to treat, or is it a pain syndrome with a referring pattern? Okay, get back onto this one. So that would be the taping for supra and infraspinatus, but I will demonstrate those if the slide is not clear enough. You will see it now when I demonstrate on Charlotte, okay? And then we get teres minor, which is often forgotten. And I cannot tell you how many of my patients that when you release a tight teres, how their anterior shoulder pain improves. Okay. Now, I've discussed some of the other muscles. You might have wanted to tape the teres with the supra. I'm doing deltoid with the supra. But in all of them, we want to correct the anterior top. So we place the arm next to her. We place the base down, 4 fingers below the apex. Okay. Before you start taping, make sure that you can cover the whole area. Have something to hold on, and you ask her to bring her arm on a stretch. Remember, with a kinesio, if we want to use the tape for what it is, then we put the muscle on stretch. Okay, hand behind the back. Come round. On a stretch. If she turns sideways, then you can see you've got the deltoid tape like that. Then as she is sideways, we're going to place the base down just over the chromium there for supra. Okay, that's going to go there. There's the spine. So make sure as you place your base down, your direction is correct. There we go. That's a better direction there. Okay. So we will take her hand behind her back. We always just turn the head away slightly. There.